the gut. Gastroenteritis when defenses are cut. Son A is most common in the USA. Bloody diarrhea gives Shigella away. Blue-green on hectone is how it will grow. No H2S means no black will show. Salmonella makes black colonies instead. Shigella is non-motile as it spreads.
Acid resistant with a low infectious dose. Few organisms are enough for the host.
Through M cells and pia patches it breaks in. Then type-free secretion lets invasion begin.
Shigella brings bloody inflammatory flow.
Leukocytes are a sign you should know. M cells let it enter, then actin drives the ride. Facultative intracellular from cell to cell inside.
Shiga toxin
shuts the 60s down.
protein
Synthesis stops when the toxin comes around. Dysentery type 1 can make us begin. Low platelets, maha, and acute kidney injury within.
Needle-like secretion injects proteins inside. It weakens host defenses and helps the bacteria hide. It promotes invasion and intracellular survival. Actin-tail propulsion drives cell-to-cell arrival.
Shigella triggers apoptosis as infected cells fall. Tissue damage and cytokines inflame the bowel wall. The intercolon bleeds as inflammation grows. So bloody diarrhea will still leukocyte show.
Shiga toxin resembles the Shigella-like toxin strain. Fermented hemorrhagic E. coli with action much the same. It inactivates the 60S ribosomal site. Translation shuts down and protein cannot write. Rarely dysentery type 1 damages glomerular walls. Endothelial injury makes platelet clumping call. Microthome consume them so platelet counts decline. Thrombocytopenia becomes the first host sign.
Red cells cross damaged vessels and fragment in the streams. Histiocytes mark microangiopathic hemolytic anemia seen. Renal blood flow suffers and kidney function falls. Acute kidney injury completes the triad call. Children under 5 face HUS more commonly from Shiga toxin injury in the glomerular capillaries. Remember the triad when renal vessels take the hit. Low platelets, maha, and acute kidney injury fits.
Shigella brings bloody inflammatory flow.
Leukocytes are a sign you should know.
M cells let it enter, then actin drives the ride.
Facultative intracellular from cell to cell inside.
Shiga toxin
Shuts the 60s down. Protein synthesis stops when the toxin comes around. Dysentery type 1 can make us begin. Low platelets, maha, and acute kidney injury fit.